All right, Simon, in today's Health Alert, pregnancy-related deaths on the rise in Michigan. An in-depth report by the Detroit News has drawn attention to the high number of women who are dying while pregnant or within months of giving birth. Our chief health editor, Dr. Nandi, here to break down the numbers for Michigan and talk about what's happening, Doc.
Yeah, very alarming, right? This trend, Glenda, that we're seeing in Michigan state data shows that there are between 80 and 90 maternal deaths each year. Way too many for me. However, that number has continued to rise over the past 13 years, and there was a 33.6% increase from 2019 to 2020. Now, maternal deaths are categorized as either pregnancy-associated or pregnancy-related. Now, pregnancy-associated refers to deaths that occur for any reason during pregnancy while giving birth or within a year after the pregnancy ends, while pregnancy-related deaths are those that result from conditions related to or aggravated by pregnancy. Now, race and ethnicity factored into the latest statistics on Michigan's pregnancy-associated deaths, unfortunately. For example, the mortality number for Indigenous women, get this, is almost twice as high as for white women. And black mothers are more than 75% more likely to die than white mothers. Nationally, the numbers are high as well. The U.S. Centers for Disease Control and Prevention reports nearly 4,300 mothers died between 2018 and 2022 due to pregnancy-related conditions. And health experts say there is no reason for these numbers to be so high. And I agree. Some estimate more than 80% of maternal deaths are preventable. Wow. It's just, unbelievable.
Sad statistics.
In 2024.
Yeah, sad state of affairs. I mean, how do we turn this around?
Yeah, that's the question, right? So health experts, Glenda, point to a number of reasons for these high maternal mortality rates. They include causes that are preventable, like hypertension. Now, these are conditions that doctors should address easily and early. Another cause is underlying health conditions that weren't treated before the woman became pregnant. And another major reason, according to doctors and researchers, is medical racism. And this is very unfortunate, in my opinion. The CDC reports that women of color are more likely to be mistreated because of discriminatory medical practices and biased healthcare providers. Here in Michigan, the state and numerous local agencies are working hard to lower the maternal mortality rate, though, through policy recommendations, addressing racial disparities, education initiatives, and better wraparound services mothers and mothers-to-be. So to me, listen, if you have conditions that you need to treat, go see the doctor. And then all of us in the medical profession, we've got to treat people equally. And this is how it is. Unfortunately, the data doesn't show that.
Well, that's the saddest statistic of all,
100%.
Especially when you said 2024.
Exactly.
All right. We'll see you soon, Doc.
Of course.
Thanks so much. If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or X. We'll get it right to him. And this week on the Dr. Nandi Show, it's all about autoimmune disease, a wide-ranging discussion of the modern epidemic that is autoimmunity. Dr. Tom O'Brien details the broad spectrum of autoimmune disease and how to spot the signs of a problem before it's too late. Also, Keisha Ewers discusses how suppressed emotions can morph into a physical disease and much more. How you think is how you feel. Dr. Nandi, Saturday, July 13th, 11:30 a.m.